Health Nuts, episode 27.
You're listening to Health Nuts with Dr. Chris Carr. Making lifestyle changes is hard for many people, and not knowing what to do or how to do it makes the task all the more daunting. Here at Health Nuts, we focus on helping you live a fuller life by discussing everyday health issues and exploring breakthrough solutions on how to overcome them. And now, here's your host, Dr. Chris Carr.
Welcome back to another episode of Health Nuts. I'm your host, Dr. Chris Carr, and today I've got an awesome guest for you, and that is one Dr. Laura Belus. She's a graduate of the Canadian College of Naturopathic Medicine, and she believes that health is attainable at any age. As a young adult, she made the connection between the foods we eat and how we feel. This was a powerful tool in reversing her long history of migraines and skin concerns. In recent years, she has developed a special interest in cardiovascular health, aging well, and the effects of stress on the nervous system. Following the likes of Dr. Dean Ornish and Dr. Mark Hyman, she has extensively studied the profound positive effects of lifestyle medicine on many chronic diseases. She currently is in collaboration with Dr. Howard Schwartz, who is an integrative cardiologist out of New York City. The philosophy is by rebuilding the foundations of health, diet, sleep, exercise, and lifestyle, one can restore the body to a place of balance and experience a greater vitality, regardless of age. Dr. Laura, welcome.
Thank you so much, Dr. Carr. I'm really happy to be here today.
So that was more of the formal intro of you. Tell us a little more about yourself. So you're more north than me in Canada. What's going on up there?
Yeah. Okay. Canadian born and raised. I've just practiced outside the Toronto area, so not too far from the U.S. border there. It's a pretty large city. And I am a naturopathic doctor, so focusing on, as you kind of mentioned, the lifestyle component of medicine and how to get people healthy and stay that way using natural therapies.
What made you go down that road?
It's been, I guess about 12 or 13 years ago since I first saw my own naturopath, and it was for a history of migraines. But specifically, I went in because I had adult acne. So I had clear skin my whole life, was working a full-time administrative job, and skin just flared up, and I needed to get to the root cause. Nothing worked. It's funny, what sends us to get sometimes help is either something we can physically see or when we've just had enough. So the migraines actually were a secondary cause, but when I cleared up my skin, my migraines went away. So I knew, hey, getting to the root cause really could actually lead to lasting results.
So you were getting the migraines not from Tylenol deficiency. There's actually something else going on.
Right. Yeah. I definitely wasn't short of Tylenol because I was taking a Tylenol or Advil, at least 2 or 3 times a week, if not more, and thought that was normal. Just thought I would just get by and make do. But wow, what a change when you realize how good your body's designed to feel. There's no turning back. No,
I have a similar history with it as well. Is that I grew up with chronic migraine headaches. And I never put 2 and 2 together. My parents didn't know any better. And it ended up being I had so many dietary allergies. And I was growing up on peanut butter and jellies, Coca-Cola, and no fault of their own. But I suffered throughout, even in college before I found out, okay, this is what's going on.
Yeah. And when you find out the root cause of things, it's so liberating. You don't have to go back to being victim to something that really can be corrected.
Yeah, and I'm looking forward to getting your expertise on this because you're going to really bring home a lot of information with all your years of experience. And to the audience today, it's all about balancing your hormones naturally. Yes. She's an expert in the field. I'm looking forward to hearing what she has to share with us. Before we get into the meats and potatoes of this, I always like to start off with a positive affirmation, a quote, maybe words of wisdom, something that's in your office or you talk to your patients a lot about it. What's one for you?
When it comes to, lifestyle medicine, Hippocrates said, let food be medicine and, let medicine be your food. And it is so true that from a foundational standpoint, food is medicine. It's not good to have. It's not healthy to eat well. It's actually medicine. And when we look at that, when we look from that lens, it's just so empowering to know that in our cupboard, in our grocery store, in our fridge, we have the keys to health. As simple as that sounds, it is just proven true almost daily in my practice.
Yeah, one of the especially one of the tenets of chiropractic that has, been taught ever since it was developed in 1895, is that the power that made the body heals the body. And if you're putting the right things into your body's not designed to be sick. It's designed to be healthy. You just have to kind of get to the gateway and find out exactly what that is. So I love that share, especially how food plays such a vital role in it.
Yes.
So getting into this with balancing your hormones naturally, there's so much that goes to it. You can Google balancing your hormones naturally, and there's going to be 20 different opinions on how to do it. Before, I always like to say I like to test. I don't like to guess. So if someone thinks they're having issues within their hormones, what's some testing they can get done?
Well, I think, I tell women and men alike, I tell them all the time that if they really feel that something is not right, then there probably is reason to investigate. Some of the common causes or some of the common concerns around hormone balance would be things like, irregular periods, a lot of pain, hair loss, skin concerns, changes in libido, a lot of things that can really just start to become an issue. And then you say, hey, what's going on? So testing does give you more direction. I almost always recommend a saliva test for hormones. Not only is it non-invasive for patients, so they just sort of get a saliva sample into a small tube. They can easily do that in the comfort of their own home or in the office. And it does give us more accurate results, sensitive results as to what the hormone levels are like in the tissue.
Outside the saliva testing, so what are you looking for? So you're looking at the hormone levels within the saliva testing. Is there any way, so if they're doing a home test, can they mess that up, or is it pretty much fail-proof?
You know what? As long as they get a large enough sample, absolutely, it is sort of fail-proof. The sample's pretty stable as well, which is good as long as it's packaged appropriately. These kits these days from labs in Canada and the U.S. are pretty good at making sure the patient does their homework and kind of gets the sample done and it gets shipped off appropriately. So it is fail-proof, absolutely. And a lot of them are pretty comprehensive as well. So 1 or 2 tubes often is enough for a very comprehensive panel looking at all hormones.
So the patient or the audience member that's listening right now, they're having some of these symptoms you've mentioned, maybe the change in libido, their energy stinks. They might be going through seasonal affective disorder. Now that they've recognized it, now that they're testing for it, what's the next step?
So that's, once they've tested, that's where, that's where the information is, but that's also where a lot of patients or individuals kind of hit a roadblock. As practitioners ourselves, I pride myself on really understanding the anatomy, the physiology, or whether it's in this case, the biochemistry of how hormones work. So if your estrogen's low, for example, or your cortisol in the morning is too high, what do you do about it, right? So then you go back to Dr. Google and say, well, how do I lower this or that? And that's where really the value comes in to work with a healthcare provider that knows functional medicine, that knows lifestyle medicine, that can actually interpret your test results.
And there's so many misnomers, especially out there, that functional medicine's been, which was once perceived as just not something that was valid. Now everyone is saying they're a functional medicine doctor. How can you weed out somebody who is as somebody who's got maybe the weekend certification?
Right. And that's a really fair point. And it is a growing concern in my, area of practice as well. So making sure that they've gone to an accredited school. So if they do have a degree, initially, whether that's chiropractic, naturopathic, or even a medical doctor, if they are certified by another body, for example, functional medicine body, that's always a plus. But to talk to your colleagues or talk to your friends or talk to your community, see who is rated highly, who's rated well. And most practitioners, if possible, if you're considering working with them, they may be able to give you a few moments of their time just to see if it is a good match. I don't know if that's something you do in your practice, but I always try and give patients some information. Can I help? Or if not, I can recommend them to someone. But the hormones are my thing, so I'm often working with those individuals.
Yeah, it's such a good point, because especially when you're working with patients, it's got to be you got to be able to, not all personalities mix with each other. And I think sometimes when a patient ends up in a doctor's office, whether it's in your office or my office, my personality may not mix with every single person that's out there, and that's okay. It's not supposed to. But it's whenever you're looking for a provider, it's such a good share. You want to make sure that it's the right fit for you.
Absolutely, because it is a relationship. It's not a one-time thing. Working in this line of work, we really pride ourselves on getting to the root cause, but that does take some investigation. That does take some collaboration. I like to say that my patients are in the driver's seat. I'm just in the passenger seat, navigating them to get to where they need to get quicker and more effectively. Miss some speed bumps along the way.
Yeah, I love that analogy because everyone needs a coach, and especially when it comes to reading saliva panels, if you're doing hair analysis. Because once you have the diagnosis, you know what's going on. Now you need the game plan. So what's the game plan what's the game plan you give your team? What's the next step based off nutrition, exercise? Where are we going from there?
Yeah, you know what I like to look at, as I mentioned in my bio as well, is the foundations of health. So I look at 4 areas: diet. We'll talk about that in a moment. Exercise or movement. Sleep is number 3. And stress is number 4. So all of those areas do need to be touched on to some degree. Now, right off the bat, depending on the hormonal concern, I will often address the need for the quickest results to get the patient feeling better. So if they're suffering from, night sweats, we need to get that reduced. And sometimes that does require, for example, bioidentical hormones. Naturopathic doctors in Ontario can provide that. I know a lot of practitioners in the US can also do that. Not the solution for everyone, but as an example, a safe, natural, effective way to get results quicker. But if I said I'd ignore all the other aspects, like how are they exercising? Are they moving? Are they sleeping? Quality sleep. I can't tell you how important that is for hormone balance. These are things that can't be missed as well. So the game plan has to be comprehensive.
What's your definition of quality sleep?
The research says that the most longevity is obtained around 7 to 7.5 hours per night. Now, that raw number doesn't really tell us too much if you're not sleeping, consistently throughout the night. So I always ask my patients, are they falling asleep within 20 to 30 minutes? Now, not everyone's timing that, but are they tossing and turning a lot before bed? That's a first indicator. Are they staying asleep? So if they wake once per night to use the washroom, when you're over 50, 55, that can sometimes be okay because our sleep requirements decrease after that age. But for most of us, we think waking 2 times a night just to use the washroom or to sort of toss and turn and get back to bed is fine. It does affect the sleep cycle and definitely affects restedness. So, hey, how do you feel in the morning? That's probably the best indicator.
Yeah, when your 2 feet hit the ground, are you hitting the snooze button 5 times, or are you getting up within the once or twice after it goes off?
Absolutely, yeah.
I love that. So I talk a lot about sleep as well, and I never put it together with the interruptions, whether it's getting up once or twice or 3 times. That does play such a huge role and it breaks up your sleep cycle completely. Then you have to
huge role. Yeah, and regarding hormones, a lot of people that have low progesterone or irregular cortisol patterns will find they're often waking between 1 and 3 a.m. That comes up a lot, or they're frequently waking. So I can't stay asleep for more than 3 hours, for example, is something I hear a lot with women, especially around menopause. And that doesn't necessarily mean they need melatonin. It may mean they need a different type of melatonin, like a prolonged release, or they need a little bit more progesterone support.
It was whenever I was growing up, I would walk in to see my mom, and she would be in bed, and she'd have like 2 fans on her. And it would be like the middle of winter. I'm like, what are you doing? She's like, oh, I can't sleep because I'm so hot. I'm like, it's 20 degrees outside.
What is that in Celsius? Something like I'm below freezing. Absolutely, yes.
Yeah, wait, about 10 degrees below freezing. So,
and you know what? Yeah, and a lot of women say, I try and educate patients saying, just because something is common doesn't mean it's normal. So because every woman, is sleepless or needs all those fans or experiences a lot of hormonal changes, doesn't mean you have to live your life that way. Doesn't mean you can't get natural relief.
Right. Love it. The other ones I want to hit on each of these 4 pillars you touched on.
Mm-hmm.
With the exercise, are you just saying get out there and walk and move and you're good? Or are you doing anything specific?
Well, again, depending on the level of current exercise. So I say just get moving if you're not already moving. A lot of women do like to get out there and do something simple like walk. However, pain is an issue. So if you're having knee pain, if you're having hip pain or ankle issues, you don't want to be working through or walking through the pain. You want to get that addressed. So I'm always working with a team of healthcare providers, like functional medicine, movement practitioners. So whether that's a physio, whether that's chiro, whether that's an osteopath, a lot of times multiple practitioners, because if there's pain with movement, we have to address that first. That should not be the reason why you sort of throw in the towel on exercise. I will say though, when it comes to hormone balance, maintaining a healthy body fat percentage and muscle fat percentage is very key. So doing some sort of strength or resistance work, even if that's just using your own body weight in a way that's safe, will help to eliminate some of the excess hormones that can build up if fat tissue is in excess.
And when you have that taking place, and you hit the nail on the head saying, because pain is the primary barrier to exercise. If you wake up and you got a bad hip, bad knee, bad whatever joint it is, why would anyone want to do this? They know the aftermath they're going to feel terrible for the next 2 or 3 days. So I love that you shared that to get that addressed. How would somebody know what the body fat percentage? Would that just be by doing it? Is there testing they can do with that as well? Is it one of the grip tests that they can use? Which ones do you recommend for your patients?
Yeah. So there's some practitioners that do, that are more in the fitness and sort of body composition field. I have a basic body composition scale that gives us some parameters on body fat, muscle mass, total body water. And that just gives us a general idea. I mean, you don't take it to be the be all end all, but it does indicate, where we are today and where we're headed. So like I said, body fat should be less in most everybody than body muscle percentage. And a lot of women, I do see the fat percentage is exceeding muscle mass. So that really can disrupt hormone levels, especially estrogen.
Yeah, with those hormones going up to the level that they go up as well, whenever they're unbalanced, it's like trying to howl at the moon, trying to lose weight.
Absolutely.
It can be so difficult, especially because it affects females. I mean, it affects males as well, because males have low T and various other hormone deficiencies, but I would say it's almost more common that females address it more so than males.
Absolutely. And you're right. It does address males in a different way. However, with females, they're struggling, and they've been doing this for quite a while when it comes to weight loss or just feeling good, especially around the midsection. That can be really frustrating, and often hormones are the root cause.
We look with the midsection type stuff, all the xenoestrogens that are in the environment that are in diet. I know you want to touch a little bit on diet, and I want to hear what you have to say about it. When you're working and counseling with a patient with balancing their hormones, what are you touching on them? What are you looking at first within their diet?
Well, so we talk a little bit about lowering inflammation is really big. So the big organ that we have to work on when it comes to hormone recycling and detoxification is the liver. Yes, the gut is involved. Yes, the lymphatic system and kidneys, those are all important, but the liver is the one that is just kicking out those extra hormones. Unfortunately, most of us have that liver working overtime, whether that's with over-the-counter medications for women who are on birth control pills, cold and flu things, and anything that you don't even consider a medication does have to be processed through the liver. Not to mention the pharmaceutical drugs that are needed, perhaps, in that moment. So the liver does need a bit of a break. In order to do that, we look at removing the inflammatory foods. So things like, the big categories are dairy. Gluten gets a bad rap, and sure, it's advisable to remove gluten. But for those patients just starting out, I say take a break from wheat. So for example, rye, spelt, those are okay to leave in for a shorter period of time, oats, but the wheat is probably the most inflammatory of all the grains. So nip that in the bud and get rid of that out, and you'll notice a lot of water weight start to shed and hormones are starting to clear out slowly, but pretty efficiently.
What would you say? So with the wheat, obviously I'm going to assume you're going to say the refined flour altogether. If somebody still wants to eat bread, would you put them into another option? Would you say give it maybe 4 to 6 weeks?
Right, yeah. That bread, it really holds us. Definitely bread is not all bad, especially to start out. So rye bread is what I typically recommend. Now, again, it comes down to patient education, reading labels. I have a lot of patients that say, I eat rye bread, light rye, dark rye. You read the label, second ingredient is wheat. So if it's 100% rye, easy to find, that is suitable for a lot of patients. But over the years, doing a lot of food sensitivity testing, wheat comes up for a lot of people. Not everyone is sensitive to gluten. So the whole, boatload of grains, wheat tends to come up in about 80 to 85% of my patients. So that's a safe one to start avoiding.
Yeah, I had a workshop on Tuesday night. I was talking about gut health and some of the immune system downers that are out there. And those are two that I touched on, were dairy and wheat, like you said. The other one, which I always like to share, is it's common, especially well, at least in the States, because a lot of people are overweight here, are all the frozen foods that people will live as their diets. And they'll be living off these lean cuisines, and they live off that frozen food section. And they're like, well, it only has 100 calories and 6 grams of protein. I'm like, well, but how it's made is completely toxic. And I think a lot of folks don't realize the amount of stuff that's in the box foods.
That's right. Box, package, box, bag, those types of foods are always great to avoid when I'm doing a detox for hormones with my patients, even if they're not ready to go the route of eliminating certain food groups. As you said, anything that you can make from scratch, almost free reign to do that. Even if you are going to do good quality dairy or the odd, wheat product, I'd rather you be making all the meals. Even if it's batched and frozen ahead of time, it doesn't have to be complicated. That's already a step in the right direction.
And that's one of the best takeaways, I think, especially with diet that you shared, is preparing for it. And it's, if you can come with that pillar and prepare and have it ready to go and freeze it, you don't have to worry about, Friday night what you're having for dinner. You already thought about it on Sunday.
That's absolutely right. Preparation is key. And, it's funny, kind of ironic, but when I talk to patients about stress management, and that is one of the pillars, stress, we don't want the health journey to be stressful. That kind of defeats the purpose. So if you're worried and irritated all week because you don't have things prepared, I say give yourself an extra week before you start the program or before you eliminate. Clean out some of the stuff that's maybe in the fridge or freezer or cupboards. Give yourself that time to be prepared, because if you do a little bit of prep work, it goes a long way.
That when you just hit up the other question I was going to lead to was stress. And that was the last pillar that I wanted that you had discussed. Stress management techniques, same thing. People are working multiple hours. Sometimes they have one or two, or they have multiple jobs, multiple kids. This time of year, it's high stress. It's the most common time of year for heart attacks. Last, second, third week in December. What can we do?
Yeah, stress is such a big area to tackle. But to be honest, it is almost at the root cause, in part, of almost every health concern that I see, in part. And even if you say you're not stressed, the reality is most of us are living busy lives. So this word stress, a lot of people don't want to relate to, but how busy, how much are you juggling? And if you can kind of rate your stress on a scale of 10, so 0 being no stress and 10 being the most stress you've ever had, if you're having stress more than 5 or 6 most days, and that just could be busy, just being busy is a stress on the body. We need to address that. So sleep works hand in hand. Getting enough sleep does start to restore your cortisol or your stress hormone levels. Magnesium is probably one of the best go-to stress relief supplements that I use, just from a foundational level. A lot of patients maybe need a little bit more support, but magnesium before bed or in the evening really does help the patient wind down and start to reset some of those hormone levels.
Yeah, I got a page. That's why I love doing this, because I've been in practice for 14 years, but I got a page of notes.
Yeah, it's good things to sort of sneak in there, right? Add in.
Add in, yeah. It's never stop learning, and I teach this as well, but even just your knowledge as well. So I know that if I'm learning something from this, the lay person probably has 5 pages of notes by now.
Yeah, some good tips that people can start to use right out the gate. They don't have to wait to take a step towards better health. And I think that's why, I'm so happy to be on the podcast today, because these tips are tangible. People can do something with them.
Yeah, there's just so much knowledge that was shared. I have a couple other questions I wanted to get into. Is there anything else with those 4 pillars that you wanted to get into before I moved on?
Well, no, I'm actually happy we were able to touch on each one of them. But the highlight here is that they're all related, and it's like legs of a stool. If you don't address one of them, oftentimes we can make it through. But once we leave that for the long term, it will eventually catch up to us. So I look at them as 4 buckets or 4 legs of the stool. You have to focus on each of them, even a little bit, as you go through your health journey.
Yeah, such a great share. Too often we may only be doing one thing right, two things right. We got these other things that are breaking down in our lifestyle, and we don't realize we're not healthy. It's because you're completely neglecting these other areas, whether it's stress, with the job stress, the home stress, financial stress. You never address that. You keep that in the corner, but yet you eat clean and you exercise and you're getting your sleep. Why am I still breaking down? So
that's right.
So the name of this podcast, it's called Health Nuts. What are 3 things that you're doing day to day or week to week that make you a health nut?
Yeah. I think I was a health nut when I was like 8 or 10 years old. I remember demanding that my mom only buy whole wheat bread and stop with the white bread. I don't know where I got that idea. I must have, saw some sort of magazine or something as a kid. My grandmother was very into health. So I joke that I've always considered myself a health nut. But now I think the 3 things, I'll just say in general, it's consistency and there are little things that I do. So I've adapted a lot of small behaviors that go a long way. So number 1 is lemon water in the morning. I don't start my day without lemon water. And I don't mean a sort of a squeeze of lemon. I mean half a lemon squeezed in about half a cup of room temperature water. First thing when I wake up, it should be sour. That stimulates the liver, the gallbladder. So fantastic. Meditation, mindfulness. So I do about 5 to 10 minutes, not a lot. I'm busy too, but 5 to 10 minutes, usually before bed. And like I said, that's partly because of that stress hormone reset. I use a couple of apps out there. There's a lot of great ones that are free. Stop, Breathe, and Think is one of the main ones that I use. There's Headspace. There's Calm. Calm.com is a great one. And a lot of these don't take long. So 5 minutes to help me reset and recharge. And the last tip, turmeric. Turmeric, I spread turmeric on everything. Turmeric is best absorbed with black pepper. So the spice on its own, again, great to use it. Add it whenever, eggs, soup, stew. You can't even taste it half the time. It's just sprinkling it, but a little goes a long way over time. So remember, little things, they do add up for the months and the years.
Yeah, I think we might be distant relatives because it's we got all the same. I do all the same stuff. It's funny.
Awesome.
So you have that. You might have had that patient that you're working with right now, or there's this audience member out there that they're struggling big time, and they don't know. They don't know which end is up. They might have already tried to work with somebody in the past. What would you tell the struggling person out there that's listening?
That's a great point. The thing is, knowing that having hope that things will get better and that things can get better is vitally important. How you approach your health and your vision for your health is everything. If you work with one practitioner and, like they weren't their best fit, or you got one step of the way, or you learned what didn't work, that's a step in the right direction. Don't get overwhelmed is what I would tell individuals. So taking a step in the right direction, no matter how small, is still a step. Forward is forward, as they say. And learning what doesn't work is valuable for your health journey. I wish we could all get it right on the first try, the first practitioner, the first diet change we make or exercise routine we stick with. But the body's a little bit more complex than that. So understanding what works does take a little bit of trial and error, and knowing that you have a couple of healthcare providers hopefully in your corner is the best way to make long-term progress.
I love it. You said it all.
Well, there's a lot to say, but there's also a lot of ways to keep it simple, right?
I can hear it now. But I had to go back and listen to that again. I had to go back and listen to that again. It's just so much info. But I love interviewing. It's one of the reasons why I do this. Is just I just love you sharing your message. I appreciate you coming on and sharing your message. I know there's going to be people that want to find you, or possibly I know you do a 21-day detox a couple times a year. Why don't you talk about that?
Yeah, so I am always online giving lots of value, lots of health tips on my social media. Instagram is the best way to find me, at Dr. Laura Belus. And I do have a 21-day detox program. So I'd love to work with everyone one-on-one, but over the last 10 years, I've developed a 21-day online program with all the support, all the questions, comments, and things you need to know about doing a detox the right way, at least in my opinion. And it's the one detox that I constantly do with my patients and do myself twice a year. So you can get all that info on my website at drlaurabellis.com.
And to the audience, I'll put links to Dr. Laura's Insta account, and I will also put links to the detox program in the show notes so you have them, so you can click on it. It'll take you right there. It's really user-friendly, and I can't say enough good things about how professional she is and how lucky you are to have heard her message from her today. It was just awesome. Dr. Laura, thanks for coming on.
Thank you so much for having me, Dr. Carr, and keep up the good work. This is a great podcast. Can't wait to listen to it myself.
It'll be out there in a couple of weeks. And to the audience, I'll talk to you all next week. Have a great week, great weekend. Bye now.
So, you've heard from the experts yourself this episode and have gotten some golden nuggets on health. There is so much more to come and so much more to learn. Head on over to pghcw.com. Again, that's pghcw.com, and sign up for our newsletter where you'll receive free info on how to get and stay healthy. Thanks for listening, and we'll see you next time on Health Nuts with Dr. Chris Carr. Be sure to subscribe to the podcast and please leave a review.